Okay, good evening and warm greetings to everyone joining us on this special occasion of World Parkinson's Day. I'm Dr. Prasida, Healthcare Advisor at VIAMS, Dr. KV Vijayan Institute of Ayurveda Medical Science Private Limited, and it's my privilege to be your host for today's webinar titled Bridging the Parkinson's Care Gap Through Integrative Neuro Rehabilitation. So, Parkinson's disease is not just a neurological condition, it is a life altering journey that affects movements, emotions, communication, and overall quality of life. Despite advances in care, many patients continue to face gap in comprehensive management. So, in today's webinar, we focuses on how a team-based multidisciplinary approach integrating Ayurveda, neurology, physiotherapy, speech therapy, psychological support, naturopathy, and yoga can bridge these gaps and significantly improve patient outcomes. We are honored to have with us an exceptional panel of experts from VIAMS, professionals who have dedicated their careers to neurodegenerative care, patient centered healing, and integrative medicine. So, before we begin, I would like to sincerely thank each one of you, patients, caregivers, healthcare professionals, students, and members of public for joining us today. Your presence reflects a shared commitment to awareness, compassion, and better care. Now, let me introduce our distinguished panel for today's session. Dr. Vijit KV, Chief Physician and Managing Director, a renowned Parkinson's specialist and expert in integrative neurorehabilitation. Dr. Neetu Esjit, who brings a focused expertise in Parkinson's disease in women. Dr. Aditya Tangapan, our resident medical officer with experience in structured Ayurvedic management. Dr. Aruna KP, naturopathy specialist focusing on natural and preventive healing. Dr. Prasad AP, chief physiotherapist specializing in mobility and rehabilitation. Dr. Anup Sedi, clinical psychologist addressing the emotional and mental health aspects of Parkinson's care. Mrs. Dilna Sultana, audiologist and speech language pathologist focusing on communication and swallowing care. After the expert sessions, we will have an interactive Q&A session and encourage all participants to share their questions in the chat box. Now, with immense respect and great pleasure, I invite our keynote speaker, Dr. Vijit KV, Chief Physician and Managing Director of VIAMS. Dr. Vijit is a renowned Parkinson specialist and a pioneer in integrative neurorehabilitation. With years of clinical experience and research, he has developed VIAM's integrative treatment protocol focusing on holistic, patient-centered care that address both neurological and functional aspect of Parkinson's disease. Over to you, sir.
Good evening, everyone. Thank you, Dr. Prasida, for the introduction. So, at the outset, I would like to sincerely thank the host for that warm and kind introduction. I feel truly honored to be part of this meaningful gathering on the occasion of World Parkinson's Day. I hope I'm audible to you. Am I?
Yes, sir.
Thank you. I extend my heartfelt welcome to each and every one of you who has joined us today. Patients, caregivers, family members, healthcare professionals, and well-wishers. Your presence here is not just an attendance. It is a reflection of care, awareness, and hope. And today, before I begin, Speaking as a doctor, I want to speak you as someone who has spent years closely observing this journey, walking alongside patients and learning from them. Because Parkinson's disease is not just a medical condition, it is a life journey. And the people who live with it are not just patients, they are Parkinson's warriors. Yes, I truly mean that. Because what may appear as a simple symptom to the outside world is actually a daily challenge that requires immense strength. So imagine waking up in the morning and your body does not respond the way you expect. Imagine wanting to walk faster, but your legs don't cooperate. Imagine wanting to speak louder, but your voice doesn't support you. Imagine your own body not listening to you fully. And yet, despite of all this, you continue. You adapt. You find ways. You show up for the life every single day. This is not weakness. That is strength. This is resilience. That is why I call you Parkinson warriors. And I want every person listening today, especially the patients, to remember this. You are not alone. And more importantly, you are not helpless. Now, I would also like to take a moment acknowledge the caregivers because because behind every Parkinson patient there is someone standing quietly with them. A spouse, a son or daughter, sibling, a friend who adjust their life, their routine, their emotions to support their loved one. Caregiving is not easy. It requires patience, understanding, and emotional strength. Many times, caregivers sacrifice their own comfort silently. So, today, I want to say this very clearly. Caregivers are not just supporters, they are co warriors in this journey. Now, let me share something from my experience. When a patient first comes to me, one of the most common emotions I see is fear, unusual fear, fear of the unknown. Questions like, Doctor, will I become completely dependent? Doctor, will my life change completely? Doctor, is there any hope? Doctor, is this curable? A lot of questions are there. And today, I want to answer the questions right here. Yes, life will change, but the change does not mean the end. Change means adaptation. Change means learning new ways. And most importantly, with the right treatment, with the right guidance, with the right support system, quality of life can improve. I have seen this. I have seen patients walk better. I have seen patients reach confidence. I have seen families become stronger. So today's session is not about fear. It is about understanding and empowerment. Another important thing I want to tell you, Parkinson's disease is often misunderstood. Many people think it is just a tremor disease. But as we go deeper today, you will understand it is much more than that. It involves the brain, it involves the body, emotions, sleep, energy, and even relationships. And because of this, and just because of this, treating Parkinson's is not just about giving one medicine. It requires a complete approach, a thoughtful approach, an integrative approach. And that is exactly what we are going to explore today. Now, before we move forward, I want you to do something very simple. Just reflect for a moment. If you're a patient, think about your journey so far. If you're a caregiver, think about the person you are supporting. And if you are here to learn, just keep your mind open because today's session is designed to give you clarity, not confusion, confidence, not fear, and hope, not hopelessness. As a Parkinson's disease specialist, My intention today is very clear. I'm not just here to give you some informations. I'm here to help you understand, connect, and feel reassured. Because knowledge becomes powerful only when it reduces fear. And that is exactly what we aim to do today. So, with that thought, let us begin the journey together. Let us understand Parkinson's disease. It's not just as a condition, but as something we can manage, support, and improve. Now, let us start with the most important question. What exactly is Parkinson's disease? When people first hear this term, it often creates fear. The word itself sounds complicated, technical, and sometimes overwhelming. But I want to simplify this for you. Parkinson's disease is a neurological condition, a neurodegenerative condition. That means the brain cells get gradually degenerated. So it's a brain disorder. And the brain, as we all know, is like the control center of our body. So every moment we make, every step we make, even something as simple as smiling or turning our head, all of this is controlled by the signals from the brain. Now imagine this. The brain is sending instructions, but the body is not receiving them clearly, or the signals is delayed or even weak. This is what happens in Parkinson's disease. Let me give you a small example. Suppose you want to get up from a chair. In a healthy system, the brain sends the signal instantly and your body responds immediately. But in Parkinson's, that response becomes slow. So the intention is there, but execution becomes difficult. Another important thing, this condition is slowly progressive. There are certain conditions like moderate and fast progressive that will not be typical Parkinson disease, that may be motor neuron disease or amyotrophic lateral sclerosis known as ALS. So this Parkinson's disease does not come suddenly. It begins very quietly. Maybe a slight tremor in the hand, maybe a feeling of stiffness, maybe handwriting becomes smaller, and many times people ignore these early signs. They think this is just age, or maybe I am tired. But slowly, these small changes begin to grow. Now, here is something I want all of you to clearly understand. Parkinson's is not just about the movement, it affects the body, it affects the mind, it affects the emotions, it affects daily life. And that is why we should not look it as just a disease, but as a condition that affects the whole person. And most importantly, Parkinson's is not the end of life. It is the beginning of a different journey, a journey that requires understanding, support, and right care. And when managed properly, this journey can still be meaningful, active, and fulfilling. Let us discuss the common signs and symptoms we see in Parkinson's disease. Generally, we can categorize the common signs and symptoms as motor symptoms and non-motor symptoms. So, when we move forward and understand the common signs, when people think of Parkinson, the first thing that comes to mind is tremor. Yes, tremor is one of the most visible symptom, or TRAP, tremor, rigidity, akinesia, posture, TRAP. These are the cardinal symptoms of Parkinson's disease. But Parkinson's is actually much more than tremor. Let us go step by step. First, slowness of movement will be there. Patient often tell me, doctor, I know what I want to do, but my body is not cooperating. Simple activities like buttoning of a shirt, that is known as fine motor movement, tying a lace, getting up, start take more time. So these are the motor in motor symptoms. There are broad motor symptoms and fine motor symptoms. So this buttoning of a shirt, tying a lace, getting up, these are all comes under fine motor movements. And the next is rigidity or the stiffness. So many patients describe it beautifully. They say, doctor, my body feels tight or rigid. I can move my neck. I can move forward like something is holding it. This stiffness can affect the arms, legs, even the neck. So if it is affecting the arm, generally we say it is cogwheel rigidity and leg pipe stiffness, because the hands will be bent like this, and hand swing will be very less during the walking. And next is the balance and walking difficulty. Walking becomes slower, steps become smaller. Sometimes there is a feeling of instability. Now, here is something very important. There are symptoms that are not immediately recognized. Speech becomes softer, face expression is not a masked face, mood changes will be there. That comes under non-motor movement. Some patients feel very anxious, some feel low, and some feel withdrawn. So Parkinson's is not just physical. It affects the emotional and psychological state too, which comes under non-motor symptoms. And why is this important? Because early recognition changes everything. If we identify these signs clearly, we can start treatment early and outcomes become much better. Now, let us understand the progression of this Parkinson's disease, the patient journey. One of the most common uh, questions patients may ask to me is, Doctor, what will happen in future? And I always say, every Parkinson's journey is unique. No two patients are the same. Some progress slowly, some may progress faster, some may have more tremor, others may have more stiffness, but in the early stage, symptoms are mild. Patients can function quite well. This is the golden period, because this is where early intervention gives maximum benefit. Then gradually symptoms become more noticeable. Activities may require more effort. Support may be needed. But here is the most important message. Progression does not mean the quality of the loss of life quality. With proper care, patients can continue to live meaningful lives. So instead of fearing progression, we prepare for it, we manage it, and we stay ahead of it. Let us discuss the types of Parkinson's disease. When we understand that the Parkinson's is not a single condition, there are different types. So the most common Parkinson's disease, the version of the modern medicine, is idiopathic Parkinson's disease. That means we do not have a single clear cause, but there is hereditary Parkinson's disease. When genetics play a role, sometimes we see family history, whether our parents, our grandparents, our siblings, or our maternal uncle have any of neurological or neurodegenerative diseases like Parkinson's, dementia, Alzheimer's, mental retarded, stroke, paralysis, anything, they have the chance of having any type of neurodegenerative or Parkinson's disease compared to other. When it comes to secondary Parkinson's or Parkinson's disease, this can happen due to certain medications, like long-term medications or other medical conditions. If we detail about this secondary Parkinson's, somebody have even in childhood, somebody have epilepsy or meningitis or any other brain-related problems. They have the chance of having Parkinson's disease in their later stage, like 50s or 60s or 70s, and we can say it is a secondary Parkinson's. And another for lung related problem like asthma related problems or skin problems or gut problems, or somebody have any other jaundice or some other like a dengue fever or something like that, if they also have the chance of developing the secondary Parkinson's. Then there is drug induced Parkinson's. I mentioned that if we take like certain medications in the long term, they have the chance of having this drug-induced Parkinsonism. Then there is another called vascular Parkinsonism. If we have a road traffic accident, or if the hypertension patients have the chance of having very mild stroke even in their sleeps, that may progress to Parkinson's disease, and they are known as vascular Parkinson's disease. Then some chemical interaction Parkinson's disease is also there. So somebody is having a close contact with the chemicals, pesticides, fertilizers, or they even live in an industrial area, or they even live in a high altitude area. They have the chance of having this Parkinson's disease, and that comes under the chemical interactive Parkinson's disease. So why is this important? Because treatment planning depends on understanding the type. It reminds us that every patient is different and the treatment must be individualized. So let us see the real life impact. Let us step out from the medical terms and talk about the real life, because that is where Parkinson is truly felt. Daily activities become very difficult. Eating, walking, dressing, things we never think about suddenly require effort. So then comes something deeper, loss of independence, and this affects the emotions as well. Patients may feel frustrated, helpless, sometimes even embarrassed. I have seen patients say, Doctor, I don't want to depend on others. That emotional struggle is very real. And then caregivers, family members, the three-tier setup, who adjust their lives, who take responsibility, who support silently. So the Parkinson is not just a patient's condition, it is a family journey. That is why treatment should not focus only on symptoms. It should support the entire ecosystem. Let's talk about the Parkinson's care gap. So the challenges in traditional care. I want to highlight a serious issue. There is a gap in how Parkinson is treated. Most treatment focuses only on medicine, but Parkinson is not just about chemicals. Non-motor symptoms will be ignored in the usage of conventional medicines like levodopa carbidopa combination. So rehabilitation will be delayed. Specialists work separately, and because of this, patient don't get a complete care. So this is the care gap, and this is where we need change. Let us see what happens in the brain. So now let us take a moment to go deeper inside the brain, because to truly understand Parkinson's disease, we need to understand what is changing within. Deep inside the brain, there are very special nerve cells. These cells have very important role. They produce a chemical or a neurotransmitter called dopamine. So dopamine is not just a chemical, it is a neurotransmitter. It is a messenger. So it helps different parts of the brain communicate smoothly, especially the parts responsible for the movement. So every time we decide to move, whether it is lifting a hand, taking a step, or even smiling, dopamine helps carry the signals clearly and efficiently. Now, what happens in Parkinson's disease patient? Gradually, these dopamine producing cells begin to reduce, not suddenly, but slowly over time. And as these cells reduce, dopamine levels also begin to fall. Sorry. So what is impact of this? The brain is still trying to send signals. The intention to move is still there, but the signal become very weak and unclear. Let me explain this with a simple example. Think of it like a mobile network. The phone is working, the tower is there, but the signal strength is very low. Because of that, communication becomes disturbed. Calls may break, voices may not be clear. There is a delay. In the simple way, in Parkinson's disease, the brain is sending instructions, but the signal is very weak, and because of this weak communication, the body does not respond the way it should. This lead to what we clinically see as tremors, stiffness, slowness of the movement. So when we look at person with Parkinson's disease, what we are actually witnessing is not just a movement problem. It is a communication problem happening deep within the brain. And understanding this is a first step towards a meaningful treatment. So, talk about the dopamine. Dopamine is a chemical messenger, or dopamine is a neurotransmitter. It controls the movement, coordination, and even more. So, without dopamine, movements become very slow, body becomes rigid, mood is affected. Dopamine pathways, uh, I'll say you the dopamine pathways in the brain. So, if the pathway is nigrostriatal, the origin will be substantia nigra. This is something technical, but you have to understand what I'm saying. So if the origin is substantia nigra and the target striatum, the function of that pathway is the motor control. But in people with Parkinson's disease, because of this degeneration, Parkinson's disease, motor symptoms will be more affected. And next, the pathway becomes mesolimbic. The VTA is the origin, when ventral tegmental area is the origin, and nucleus accumbens is the target. And the function is reward and motivation. Because of this regulation, depression, apathy will be seen in Parkinson's disease. And the third is the pathway is mesocortical, that is VTA is the origin, and prefrontal cortex is the target. The function behind is cognition, executive function, but cognitive decline in Parkinson's disease will be seen. So this is why Parkinson's is not just physical, it is a neurobehavioral. Now we discussed a lot about in the modern and the conventional. Now let us discuss what Parkinson's disease is actually in Ayurveda. So the Ayurvedic perspective of this Parkinson's disease is known as Kampavata. Let us, let us generally shift our perspective from modern neurology into the wisdom of Ayurveda. In Ayurveda, a condition that closely resembles Parkinson's disease is described as Kampavata. The word itself is very descriptive. Kamba means tremors, and Vata is the fundamental force that governs all movement in the body. So every movement we take for granted, walking, speaking, blinking, even subtle expressions, are all under the control of Vata dosha. Now, what happens when Vata becomes imbalanced? Ayurveda tells us when Vata loses its harmony, movements become irregular, unsteady, and unpredictable. And this is exactly what we observe in Parkinson's disease: tremors, rigidity, slowness, loss of coordination. But Ayurveda does not stop at just physical symptoms. It looks at the human being as a complete system where mind, energy, and the body are deeply interconnected. So, Kampavata is not just a disorder of movement, it is disturbance in the flow of life energy itself. And that is where Ayurveda gives us very profound lens, not just to identify the disease, but to understand the person behind the disease. And the sloga or the lakshana mentioned in Basavarajiya for this Kampavata is Karabada Tale Kambe Deha Brahmana Dukkide Nidra Bango Madikshena Kambavada Selekshana. So these are the symptoms mentioned in Ayurveda text even centuries before. So when we compare the dopamine versus Vata, that is, dopamine is a neurotransmitter and Vata is one of the main dosha in the human. So this is where things become very interesting. Modern science explains Parkinson's disease through the lens of dopamine deficiency. So a specific chemical in the brain completely depleted, and as a result, movement is affected. Ayurveda, on the other hand, describes it as an imbalance of Vata. Now, at first glance, these may seem like two completely different explanations. One is biochemical, the other is energetic. But if we pause for a moment and reflect, both are describing the same phenomenon, just in different languages. Dopamine represents the neurochemical regulation of the movement. Vata represents the functional and energetic regulation of the movement. So when dopamine is disturbed, movement suffers. When Vata is disturbed, movement suffers. So different frameworks, but converging on a same clinical reality. And this is exactly where the strength of integration lies. Because when we bring these two perspectives together, where we are no longer limited to just one dimension of understanding, we begin to see the condition in more complete, more human way. And that opens the door not just for a better explanation, but for meaningful and effective care. So, I'm concluding my first session with the need of integrative approach in the management of Parkinson's disease. The most important message: Parkinson's affect multiple aspects of life. So treatment must be holistic. Medicine alone is not enough. We need Ayurveda, physiotherapy, psychology, speech therapy, naturopathy, everything. So goal is not just symptom control, goal is quality of life, and most importantly, early intervention changes everything. With that understanding, at this point, I would like to take the moment to thank you all for listening so attentively. We have understood that what Parkinson is, how it affects the body, the brain, and the life as a whole, and why an integrative approach is so important. Now, our panelists will talk about the integration very soon. So Parkinson's can present different differently in different individuals. And one very important and often overlooked area is how it affects women. To take this discussion forward and to give us deeper insights into this most important aspect, I would like to invite Dr. Needu to continue the session, and Dr. Prasida will introduce Dr. Needu. Dr. Needu, over to you and Prasida. Thank you.
Thank you, sir. It was definitely an informative and engaging session. Now, I welcome Dr. Neetu Esjit, an expert in Parkinson's disease in women. Dr. Neetu brings a unique and often under-discussed perspective to Parkinson's care. Her work highlights gender-specific challenges, caregiver dynamics, and tailored management strategies for women living with Parkinson's. Over to you, ma'am.
Namaskaram. A very warm welcome to my part in this webinar. Today, I am going to speak about something very important, yet often overlooked: Parkinson's disease in women. Parkinson's disease affects both men and women. But in women, the way it appears, progresses, and impacts daily life can be very different. And today, my intention is not to differentiate, but to help you understand better, recognize earlier, and approach this journey with more clarity and confidence. It is to create awareness for everyone, but true understanding why women are often missed, misunderstood, and diagnosed late. Because in many cases, women don't present in the typical way we expect. These differences are influenced by biology, hormones, social roles, emotional stress. So, what happens? Symptoms become subtle, atypical, easy to ignore, and often they are mistaken for stress, fatigue, hormonal changes, or just part of our daily life. And because of that, diagnosis get delayed. So this talk is about not about saying women are different from men. It is about saying women deserve to be seen clearly, understood better, and diagnosed earlier. And ultimately, this awareness is not just for women, it is for families, caregivers, and the entire community. Because when we understand these differences, we don't just improve diagnosis, we improve lives. Next slide. Then the important factors for PD in women. As Dr. Vijit has already discussed the general causative factors of Parkinson's disease, but when we look specifically at women, certain factors become more significant. The first one is hormones and estrogen. One of the most important factors we need to understand is the role of estrogen. Estrogen is often thought of as just a reproductive hormone, but in reality, it plays a much deeper role, especially in brain health. It has a neuroprotective effect. More importantly, estrogen helps in enhancing dopamine synthesis, reducing oxidative stress in brain cells, supporting synaptic connections, and improving neuroplasticity. That means the brain's ability to adapt and repair. So, during a woman's reproductive years, when estrogen levels are naturally higher, there may be a certain level of built-in protection for the brain. That is, this provides a kind of natural buffering effect for the brain. It does not completely prevent the disease, but it may delay onset, mask early symptoms, slow down the progression to some extent. However, after menopause, estrogen levels decline significantly. When estrogen declines, neuroprotection reduces, dopamine support weakens, and brain resilience decreases, and may start experiencing increased stiffness, slower movements, sleep disturbances, anxiety, or mood fluctuations. And sometimes the diagnosis comes only at this stage. So, clinically, this gives us an important insight. In women, Parkinson's disease may not just be about age, it also be connected or closely linked to hormonal transition. Next is genetic factors. Sometimes Parkinson's can run in families, but not always in a direct way. Each of us carries thousands of genes, and some of these genes act like instruction for how our body and brain function. In a few people, certain genes may have small changes that called mutations. So having a gene does not mean you will get Parkinson's. It only means you may have a higher chance compared to others. Next is mitochondrial dysfunction. Every cells in our body has mitochondria. That is the energy factories. In Parkinson's, these mitochondria don't function properly. That leads to reduced energy production, increased oxidative stress, damage to neurons. And some studies suggest hormonal changes may worsen mitochondrial efficiency in women. Next is oxidative stress. The brain is very sensitive to oxidative damage. When harmful molecules increase, they start damaging dopamine neurons. Normally, estrogen helps reduce this stress, but after menopause, this protective antioxidant effect decreases. The next is medication and hormonal interactions. Certain medications or long-term hormonal imbalances can influence dopamine activity, nervous system sensitivity. This may modify how symptoms appear or progress in women. So, in women, Parkinson's disease is not caused by a single factor. It is a multi-layered interaction of hormones, genes, environment, lifestyle, emotional health. And that's why understanding Parkinson's in women requires a more holistic and personalized approach. Next slide. Early symptoms. In many women, Parkinson's disease does not start suddenly or in a dramatic way. It begins very quietly. There may be a slight tremor in the hand while doing daily activities like cooking or writing. Some may notice a feeling of stiffness in the shoulder or neck, not exactly pain, but a tight or uncomfortable sensation. Simple tasks such as combing hair, buttoning clothes, or getting up from a chair may feel a little slower than usual, and movements may not be as smooth as before. Often these changes are ignored, thinking it's just a tiredness. But symptoms may not stay the same. They can fluctuate, where one moment the person feels fine and the other moments feels worse. One of the most common complaints is fatigue. That is not just normal tiredness, but a deep draining lack of energy that affects the body and the mind. Coming to non-motor symptoms. Even before movement problems begin, the body often gives early warning signs. But these are very subtle and very easily ignored. Some women may notice a reduced sense of smell, where food does not feel the same, but they don't think much of it. Constipation is another common symptom that many live with for years without realizing its importance. Sleep problems can also occur, such as difficulty falling asleep, frequent waking, and even acting out dreams. Along with this, there may be anxiety, a constant inner restlessness without a clear reason, and a depression with low mood, loss of interest, and emotional exhaustion. Some may also experience unexplained body pain, especially in the neck, shoulder, or back region, without any clear cause. In addition, symptoms like persistent fatigue even after rest, difficulty concentrating, forgetfulness, reduced facial expression, a softer voice, or feeling dizzy on standing may appear. In women, these signs are often misunderstood and mistaken for stress, hormonal changes, thyroid problems, or simply normal aging, which is why early diagnosis becomes difficult. These symptoms may appear years before movement problems. And during this phase, the disease is already slowly progressing. And that's why early diagnosis becomes challenging. In our clinical experience, many women come to us with very subtle symptoms, not something alarming, not something that immediately looks like a neurological disorder. They often say, I feel tired all the time, my sleep is not good, my body feels stiff, especially in the neck and shoulder. On observation, we may notice persistent fatigue, mild tremors, sleep disturbances, reduced arm swing while walking, slight slowness in daily activities, neck and shoulder stiffness. But what is important is this: these symptoms are not dramatic, they are easy to overlook even by the patient. And very often they are misinterpreted as stress, hormonal fluctuations, cervical spondylosis, vitamin deficiencies, or simply aging. And many women go from one consultation to another, treating each symptom separately. Sleep for one problem, pain for other, fatigue for something else. But the underlying connection is missed. Because in early Parkinson's, symptoms don't come as one clear picture. They appear as a small scattered clues. And unless we connect these clues together, the diagnosis gets delayed. But the time clear most motor symptoms appear, the disease may have already been progressing silently for years. But in reality, early Parkinson's is not absent. It is hiding in plain sight. Next slide. One of the biggest challenges in Parkinson's disease is delayed diagnosis. Early symptoms are often ignored as many women assume they are due to stress, menopause, or daily overwork. Even healthcare providers may initially consider other common conditions like thyroid disorder or anxiety. Because of this, valuable time for early intervention is often lost. Parkinson's does not develop suddenly. It progresses slowly and silently over years, giving a window where early signs can be recognized. If identified during this stage, timely management can be started, complications can be reduced, and patients can maintain their independence and quality of life for a longer time. This brings an important shift in thinking, not just whether Parkinson's can be treated, but whether it can be detected early enough. Because early detection does not just influence treatment, it changes the entire journey of the patient. Then it is the differential diagnosis. It's very important to understand that not every tremor is Parkinson's. For example, in thyroid disorders, hypothyroidism can cause slowness, fatigue, and low energy. And the hyperthyroidism can cause tremor, anxiety, palpitations. So proper evaluations, including thyroid function test, is essential before confirming diagnosis. Another one, in some women, especially Hashimoto's thyroiditis, it is an autoimmune condition affecting the thyroid. It can present with fatigue, slowness, mood changes, and brain fog, which can sometimes mimic early Parkinson's symptoms. Then condition related to the neck, like cervical myelopathy. It can cause stiffness, difficulty in walking, imbalance, weakness in hands. So patients may feel movements are slow or restricted. but the cause is spinal, not neurological degeneration like Parkinson's disease. Then anxiety and stress disorders. It can present with tremors, restlessness, sleep disturbances, palpitations. And in many women, this is often the first diagnosis given. Another one is drug-induced Parkinsonism. Sometimes the symptoms are not due to the Parkinson's disease itself, but due to some certain medications, especially drugs used for psychiatric conditions or anti-emetics drugs. This can cause tremors, slowness, and stiffness. But the key point is these symptoms may improve once the medication is stopped. Next is vitamin deficiencies, that is vitamin B12 deficiency and vitamin D deficiency. That can cause fatigue, weakness, numbness, or balance issues, which can sometimes confuse the clinical picture. So, many conditions can look like Parkinson's in the early stages, but careful observation and the right investigations help us differentiate clearly. Next slide. Unique challenges. Women with Parkinson's often face multiple challenges at the same time. First is hormonal changes that like periods, pregnancy, and menopause can make symptoms and medicine's response unpredictable. Bone health can also be weaker, increasing the risk of falls and fractures. In addition, women are more prone to autoimmune conditions, which may further affect overall her health. Then emotionally, many women experience higher level of anxiety, stress, and depression. They may also feel guilty when they are unable to fulfill their usual family roles. Then socially, despite their illness, they often continue to manage household responsibilities and caregiving duties, sometimes with limited support or financial independence. There are also gaps in healthcare. Women are often underrepresented in research, leading to delayed diagnosis. They may also experience stronger side effects from medications, such as more noticeable movements, that is dyskinesia or fluctuations. In simple terms, women with PD are not just dealing with the disease. They are managing biological, emotional, and social challenges all at once, while still caring for others. Next important point is caregiver burden and burnout. It is an important yet often unspoken reality in PD, especially for women. In many families, a woman is not only living with Parkinson's herself, but is also expected to continue in her role as a caregiver, managing the household, caring for children, or supporting elderly family members. Even while dealing with her own symptoms like fatigue, pain, or emotional stress, she keeps going often without adequate support. Over time, this dual responsibility leads to caregiver burnout. That is a state of physical exhaustion, mental fatigue, and emotional strain. What we must understand is that when the caregiver becomes weak or overwhelmed, the entire support system of the patient is affected. That is why VIAMS Parkinson's care cannot focus only on the disease. It must also look at the person behind it, asking who is caring for the caregiver becomes essential. Proper support systems, counseling, family involvement, and shared responsibility are crucial because true healing in Parkinson's is not just individual. It is a collective effort that support both the patient and the caregiver. Then the integrative approach of Parkinson's disease. Parkinson's is not just a brain disorder. It is a multi-system condition that affects the nervous system, hormonal balance, gut health, and emotional well-being. Because of this complexity, treatment cannot be one-dimensional. Focusing on only one aspect may not address the full picture of the disease. Instead, management needs to be comprehensive and individualized, looking at the patient rather than just the symptoms. An effective approach should therefore include not only appropriate medical care but also rehabilitation to improve movement and function, along with attention to lifestyle and diet. Equally important is a psychological support, as emotional health plays a significant role in overall well-being. In addition, Ayurveda Panchakarma therapies and other integrative approaches can play a supportive role by helping restore systemic balance, improving gut function, reducing stress, and enhancing overall resilience. In this way, treatment becomes more holistic, aimed not just at controlling symptoms, but at improving quality of life in a meaningful and sustainable way. To conclude, Parkinson's disease in women is often hidden, misunderstood, and diagnosed late. But with awareness, early recognition, and the right approach, outcomes can be significantly improved. Women spend their lives caring for others, but their own health should never be neglected. If you notice symptoms, do not ignore them, because in Parkinson's, early actions makes a meaningful differences. And always remember, when women stay healthy, families and communities grow stronger. Thank you.
Thank you, Dr. Neetu, for the enlightening session. Now I welcome Dr. Aditya Tangappan, Resident Medical Officer at VIAMS. Dr. Aditya specializes in structured Ayurvedic management of neurological disorders. Her approach emphasizes precise in treatment planning and continuity of care, ensuring patients receive consistent and effective support. Over to you, Doctor.
Good evening, everyone, and thank you, Dr. Prasida. On the occasion of World Parkinson's Day, I would like to share how Ayurveda approaches the management of Parkinson's disease in a structured and holistic way. In Ayurveda, we do not approach Parkinson's disease as merely a collection of symptoms such as tremors, stiffness, or slowness of movement. Instead, we look deeper into the root cause, focusing on the underlying imbalance, particularly of Vata dosha, which plays a central role in regulating all neurological functions, including movement, coordination, and nerve communication. At VIAMS, our approach is systematic and step-by-step. The intention is not just to provide temporary or symptomatic relief, but to achieve long-term balance, stability, and an improved quality of life for the patient. Another very important principle in Ayurveda is that no two patients are the same. Even if the diagnosis is the same, the presentation, progression, and response to treatment can vary significantly. Therefore, every treatment plan is highly individualized based on the patient's condition, strength, stage of disease, and overall health. Broadly, our treatment is structured into three key stages. Shamana, which focuses on symptom management and stabilization. Shodhana, which aims at detoxification and correcting deeper imbalances. Rasayana, which focuses on rejuvenation, strengthening, and long-term support. Each of these stages has a specific purpose, and when applied in the right sequence and at the right time, they work together to provide a comprehensive and holistic management approach. Now, let us look at each of these stages in detail. Shamana therapy, that is the management of symptoms. Now coming to Shamana therapy, which is usually the first stage of treatment in most patients. As we discussed earlier, patients with the Parkinson's disease experience a wide range of motor and non-motor symptoms. Naturally, the question is, how can we manage the symptoms effectively and gently? This is where Shamana therapy plays a key role. The primary aim here is to calm the aggravated Vata dosha, which is responsible for tremors, stiffness, slowness, and instability. Shamana therapy mainly includes internal medicines, diet regulations, and lifestyle modifications. Now, focusing on internal medicines, which form the core of this stage. This medicine work at multiple levels. They help improve neuromuscular coordination, making movement smoother, support brain and nerve function, especially areas controlling movement, enhance digestive fire or acne, which is very important because in Ayurveda, treatment response depends heavily on good digestion. We commonly use Vadahara medicines to reduce tremors and rigidity, Medhe Rasayanas to support cognitive and nervous system function, and supportive formulations for long-term stability. Clinically, with the consistent treatment, we observe gradual reduction in tremors and stiffness, improved mobility and muscle strength, better sleep and energy levels, and improved mental well-being, etc. Along with this, is external therapies also support Shamana Chikitsa by relaxing stiff muscles, improving circulation, providing a sense of lightness and comfort, and supporting better posture and smoother movement. Overall, Shamana therapy is gentle, safe, and suitable for long-term care. It helps stabilize the patient's condition and prepares the body for the next stage of treatment. The next is the Shodhana therapy. Then once we establish a strong foundation with the internal and external medications through Shamana therapy, the next important question is, how do we influence the body more deeply to correct Vata imbalance and restore function? This is where Shodhana therapy or detoxification plays a crucial role. In Ayurveda, Shodhana is not just cleansing. It is a systematic process of removing deep-rooted imbalances and toxins and resetting the body's internal functioning. Before we go into Panchakarma, it is important to understand that Ayurveda therapies are done in a structured, layer-wise manner. We do not directly jump into deep detoxification. Instead, the body is first prepared through therapies that act from superficial to deeper tissues. We begin with the therapies like Abhyangam, which helps reduce stiffness, improve circulation, and prepare the muscles and nerves. Kiri, which works deeper to relieve rigidity and improve movement. Pirichil, which acts at the neuromuscular level to stabilize movements and improve coordination. Navarakiri works at a deep rejuvenative level and it provides Brahmana, means deep tissue nourishment. It also has a Rasayana effect, helping regeneration and slowing degeneration. These therapies help soften tissues, calm the nervous system, and make the body more receptive to deeper cleansing procedures. Once the body is properly prepared, we move into Panchakarma therapies, which form the core of Shodhana Chikitsa. Among these, the most relevant in Parkinson's disease are Nasya Chikitsa, Vasti, and Virejana. Then first is the Nasya. Nasya is one of the most important Panchakarma therapies in the management of Parkinson's disease, particularly because of its direct action on the brain and nervous system. In this therapy, specially prepared medicated oils or herbal drops are administered through the nasal route, and Ayurveda considers the nose to be the direct gateway to the brain, and it helps reduce tremors and facial rigidity, improve sleep quality, reduce restlessness, and promote mental calmness. The next is the Vasti procedure. Vasti is considered as the most important therapy for Vata disorders. In Vasti Chikitsa, medicated liquids such as herbal decoction and medicated oils are administered through the rectal route. This region plays a crucial role in regulating Vata dosha and maintaining proper nerve balance throughout the body. It works at the root level and helps to reduce stiffness and slowness, improve movement and coordination, relieves constipation. It has a systemic effect on the entire body, making it a cornerstone treatment. Moving to the Virejana Chikitsa, Virejana helps by eliminating accumulated toxins and metabolic waste, thereby clearing the digestive and metabolic pathways. This process improves digestive fire, metabolism, and overall energy levels, which are often compromised in Parkinson's patients due to reduced activity, medications, and disease progression. Virejana, in turn, enhances treatment responses, improves energy levels, supports better nervous system function. Overall, Shodhana therapy helps to remove accumulated toxins, correct deeper imbalances, improve the body's responsiveness to treatment, potentially slow disease progression. However, it is important to note that these therapies are done only in selected patients and strictly under expert supervision. At VIAMS, we ensure that Shodhana is performed in a safe, personalized, and well-monitored manner for the best outcomes. The next is the Rasayana therapy. It is the rejuvenation and strengthening. After the process of cleansing and correcting deeper imbalances through Shodhana, we move into the next and very crucial stage. That is the Rasayana therapy, which focuses on rejuvenation and restoration. The stage is especially important in chronic neurological conditions like Parkinson's disease, where there is gradual degeneration and loss of strength over time. Rasayana therapy goes beyond symptom control. Its primary aim is to nourish and revitalize the body at a deeper level, particularly the brain and nervous system. Through this approach, we aim to nourish and support the brain and neural pathways, improve strength, immunity, and overall vitality, help patients maintain better functional independence, enhance overall quality of life. It also plays an important role in slowing disease progression, helping patients maintain stability for a longer period. At this stage, continuity becomes very important. We advise patients to continue the internal medicines as prescribed, follow the diet, lifestyle, and daily routines that were established during the Shodhana phase. In addition, equal importance is given to the integrative aspects of care. Patients are encouraged to continue physiotherapy to maintain mobility and strength, speech therapy for communication support, other supportive exercises as advised by the integration departments. This ensures that the improvements achieved during earlier stages are sustained and further enhanced over time. In simple terms, while the earlier stages focus on removing imbalances, Rasayana therapy helps to rebuild, strengthen, and maintain the system for long-term well-being. At VIAMS, we strongly believe in an integrative approach to care. Ayurveda works best when combined with the supportive therapies such as physiotherapy, which helps improve mobility and reduce stiffness, speech therapy, which supports communication difficulties, diet management, which plays a key role in both gut and brain health, yoga and mind-body practices, which help reduce stress and improve mental well-being. This combined approach ensures that we are addressing the patient physically, mentally, and functionally. Importantly, we emphasize that early intervention and continuous care lead to much better outcomes. To conclude, I would like to emphasize the importance of an integrative Ayurveda care model. At VIAMS, we do not treat Parkinson's disease in isolation. Instead, we combine Ayurveda with supportive therapies to achieve better functional outcomes. Firstly, Ayurveda treatment is combined with physiotherapy, which plays a crucial role in restoring movement, improving flexibility, and maintaining physical function. In addition to this, we include supportive therapies such as yoga, which help improve balance, coordination, and mental calmness, speech therapy, diet support, which helps essential for both gut health and neurological function. All these together create a comprehensive care system. To conclude, Ayurveda offers a structured, holistic, and patient-centered approach to managing Parkinson's disease, focusing not just on symptom control, but on restoring balance, supporting the nervous system, and improving overall quality of life. Thank you for listening. Thank you all.
Thank you, Dr. Aditya. Now, let me welcome Dr. Aruna KP, a naturopathy specialist. Dr. Aruna focuses on natural healing, preventive care, and lifestyle based interventions. Her work complements medical treatment by enhancing overall vitality and long term well being. Over to you, Doctor.
Thank you, Dr. Prasida. Good evening, everyone. It is my privilege to be a part of this World Parkinson's Days webinar. We have already heard about the Ayurvedic approaches to Parkinson's disease. Building on that, I will now discuss the role of naturopathy, which complements and strengthens overall management. So, naturopathy focuses on enhancing the body's natural healing capacity using simple, safe, and non invasive methods to support long term well being. Naturopathy is a unique system of primary health care that focuses on natural healing and the prevention of disease. It is based on the principle that the body has an innate ability to heal itself. It uses natural therapies such as diet therapy, lifestyle changes, hydrotherapies to support the body's healing process. So, mainly naturopathy focuses to treat the root cause of illness rather than just symptoms. It oftenly considered disease as a result of toxin accumulation due to unhealthy habit and environmental factors. So, most importantly, it follows a holistic approach treating the whole person physically, mentally, and emotionally. So, with this understanding of naturopathy, let us now look at the core principles that guide its practice and approach to healing. So, first one is the healing power of nature. So, it emphasizes the body has an innate ability to heal itself when supported with proper care and a healthy lifestyle. Second one, identify and treat the cause. It highlights the importance of finding and addressing the root cause of illness rather than just relieving the symptoms. Next one, do no harm. It ensures that the treatment used are safe and natural to minimize any risk to the patients. Next one is doctor as a teacher. It focuses on the role of the practitioner in educating, empowering patient to take risk for their own health. Next one is treat the whole person. Finally, prevention is better than cure. It highlights the importance of maintaining a healthy lifestyle to prevent disease and promote long-term well-being. Now this we have understood the core principle of naturopathy. Now let us explore how these principles can be effectively applied in management of Parkinson's disease. So Parkinson's disease is a progressive neurological disorder that gradually affect the nervous system over time. It mainly impacts movement, balance, and coordination, leading to symptoms such as tremors, stiffness, and difficulty in walking. While naturopathy does not cure Parkinson's disease, but it plays an important role in providing holistic and supportive care. It focuses on managing symptoms naturally and improving the patient's overall health. Through natural therapies, lifestyle modifications, and mind body practices, naturopathy aims to enhance physical functions, reduce discomfort, and support mental well being. So, to achieve the holistic benefits, naturopathy uses a range of therapeutic interventions. So, in naturopathy, therapies are selected based on the balance or imbalance of the five great elements. It is also called Panchamahabhutas. They are earth, water, air, fire, and space in the body. So, each therapy corresponds to one or other element. So, these are chosen to restore the balance of these elements, which supports the body's natural healing process. So, let us now explore these therapies one by one. First one is hydrotherapy. Hydrotherapy is a natural treatment method in naturopathy that uses water in different forms, temperature, and pressure to promote healing and maintaining health. It is based on the principle that water can stimulate the body's natural healing mechanism by improving circulation and enhances detoxification. So, water is applied in various ways such as hot, cold, neutral, steam, or ice, depending on the condition of patient. So, this application creates a physiological response in the body. So, hot water dilates the blood vessels and relaxes the muscles, while cold water constricts the blood vessels and stimulate the circulation. So, specific hydrotherapy methods used in Parkinson's disease includes first one is spinal spray. So, spinal spray involves directing a stream of water along the spine. It helps to stimulate the central nervous system. It improves nerve conduction and reduces rigidity. It also provides a refreshing effect, help to reduce fatigue and improves alertness in Parkinson's patient. Next is hip bath. Hip bath improves your pelvic circulation and digestion, which is beneficial as many patients experiencing constipation, and it also has a calming effect on the nervous system. Next is neutral immersion bath. This involves immersing the body in water at particular temperature. It is highly effective in calming the nervous system, reducing tremors, and promoting deep relaxation, and also it's good for sleep. Next is steam bath. Steam bath relaxation and detoxification through sweating. It reduces muscle stiffness, rigidity, and also it improves circulation. Next one is cold compress to head. So cold compress applied to the head helps in calming brain activity, reduces stress, and improves mental clarity. Now this we have discussed hydrotherapy. So let us move on to another key intervention, that is massage therapy. So massage therapy is an important supportive treatment in naturopathy for maintaining the physical, mental symptoms of Parkinson's disease. It involves the manual manipulation of muscles and soft tissues to improve circulation, reduce stiffness, and promote relaxation. So, along with massage therapy, mud therapy is another natural method that helps to relax and calms the body. So, Mud therapy is a natural healing method in naturopathy that uses clean, mineral rich mud application to the body to promote health and well being. It has a natural cooling effect which helps in reducing body's heat and inflammation. And it also provides a soothe sensation to your body. Next is yoga and pranayama. So, when we talk about Parkinson's disease, we oftenly focus on medicine. But today, I would like to explore how yoga can become a gentle yet powerful support system for patients undergoing neurological recovery. Yoga is not just a physical exercise, it is a structured therapeutic system that integrates movement, breath regulation, and mental training. So, in Parkinson's, this multidimensional approach is particularly valuable because neurological disorders affect motor, autonomic, and cognitive dominance simultaneously. Let us look at this in detail. So, one of the biggest challenges patients face in neurological condition is regaining control over their own movement. So, improvement in motor control, balance, and flexibility in conditions such as stroke, Parkinsonism, peripheral neuropathy, or multiple sclerosis, patient commonly experiences muscle stiffness, weakness, impaired balance, and reduced coordination. So, this is where gentle and careful modified yogasanas can play a supportive role. So, in Parkinson's disease, we oftenly focus on muscles, movement, and strength. But one of the most powerful tools we have is something much simpler, that is the breath. So, pranayama or therapeutic breathing techniques plays a crucial role in Parkinson's disease. It directly influences your nervous system. So, some useful techniques include diaphragmatic breathing, Nadishodhana pranayama, and Brahmari pranayama. So, first one is diaphragmatic breathing. The patients are trained to breathe slowly using your diaphragm rather than accessory muscles. This reduces respiratory effort, lowers your heart rate, and induces relaxation. It is particularly helpful in anxiety-prone patients or those who with chronic stress. Second one is Nadishodhana pranayama. It is also called alternate nostril breathing. So this techniques promotes your autonomic balance and improves attention. And also researchers suggest that it can enhance your heart rate variability. Third one is Brahmari pranayama. It is also called humming bee breath. So the humming sound stimulates your vagal pathway and reduces mental agitation. It is especially used in patients with insomnia, anxiety, or emotional instability. So far we have explored how yoga supports movement, breath, emotional balance, and sleep. But neurological recovery doesn't stop with what we do on the mat. It also depends on what we nourish our body with every single day. And that brings us to another equal important pillar, that is dietetics. Let us look at few important components. So first one is antioxidant rich food. So this food helps to neutralize your free radicals and reduces oxidative stress, which is the key factor of neuronal damage in Parkinson's disease. So they may also help to slow your disease progression and protect your brain cell. Second one is high fiber rich food. High fiber rich foods improves your gut health and bowel movement, which is important because constipation is a common symptom in Parkinson's patient. So a healthy gut may also support better absorption of nutrition. Next is omega-3 rich foods. Omega-3 fatty acids have an anti-inflammatory property and helps to protect your nerves. They may also support cognitive function. So omega-rich foods are fatty fishes, flax seeds, walnuts, etc. Next one is magnesium-rich foods. Magnesium supports your nerve and muscle function. So adequate magnesium can help to reduce your muscle cramps, rigidity, and tremors in Parkinson's patient. Next one is green tea. So green tea contains polyphenols and antioxidants that may helps to protect your dopaminergic neuron and reduces oxidative stress. Next is nuts and seeds. So this provides healthy fats, antioxidants, and minerals. This support your brain health, nerve function, and overall vitality. And regular consumption may help in reducing inflammation and oxidative stress. Next one is blueberries. So blueberries are rich in flavonoids and antioxidants. Blueberries can help to protect your nerves, reduce oxidative stress, and support cognitive function. Next one is resveratrol. These are found in grapes, berries, peanuts, etc. So this resveratrol has a neuroprotective and anti-inflammatory property and potentially slowing neuronal degeneration and support brain health. Next one is choline. It supports your acetylcholine production, a neurotransmitter important for the control and memory. So overall, this food support the brain health, reduces oxidative stress, improves nerve function, and manage digestive issues. So by integrating this practice, we can help the patients to improve their mobility, balance, cognitive function, and sleep quality. So the ultimate goal of naturopathy is to treat the whole person and support the body's self-healing ability. So by saying this, I'm concluding. Thank you.
Thank you, Dr. Aruna. Now I welcome Dr. Prasad AP, Chief Physiotherapist at VIAMS. Dr. Prasad specializes in movement, rehabilitation, and functional recovery. His expertise lies in helping patients regain mobility, balance, and independence through targeted physiotherapy interventions. Over to you, sir.
Hello, am I audible?
Yes, Prasad.
Hello,
You're
can I continue?
Yes, please.
Okay, hi everyone, good evening. I'm Dr. Prasad, physiotherapist at VIAMS, and I've been working with Team VIAMS for almost 12 years now. And I'm really excited to share some insights into how we approach Parkinson's disease cases. Please feel uh, free to drop your questions in the chat anytime during the session. And I would like to keep this interaction as interactive and engaging as possible. So, in my practice, I have seen how Parkinson's can slowly make people feel like they are losing control over their own body and daily life. And that can be incredibly frustrating, overwhelming, and even frightening, not just for the persons living with Parkinson's, but for their loved ones as well. But along this journey, I have also witnessed something truly powerful. I have seen how the right movement strategies, consistent rehabilitation, and the remarkable ability of the brain to adapt, what we call neuroplasticity, can help people regain confidence, function, and hope. I'll briefly explain the concept of neuroplasticity and its crucial role in managing Parkinson's disease. Neuroplasticity is the brain's ability to reorganize, adapt, and form new neural connections. Even in degenerative conditions like Parkinson's disease, the brain still has the capacity to learn and compensate. In Parkinson's disease, there is degeneration of dopaminergic neurons in the basal ganglia. This leads to reduced automatic movements, slowness, that is also called bradykinesia, rigidity, and gait disturbances. Neuroplasticity becomes impaired but not absent, and this is where rehabilitation plays a major role. So through targeted therapy, we can promote neuroplastic changes such as cortical reorganization, that the brain shift control from automatic to conscious pathways. Use of alternative circuits through external cues, strengthening of synapses via mechanisms like long-term potentiation. In simple terms, we are helping the brain rewire itself to overcome deficits. Although Parkinson's disease is progressive, neuroplasticity allows us to slow functional decline and improve quality of life. But only with consistent, intensive, and meaningful practice, neuroplasticity is the scientific foundation of rehabilitation in Parkinson's disease. And physiotherapy plays a vital role in harnessing this potential. Movement is medicine, and through neuroplasticity, every repetition is a step towards rewiring the brain. Over the next few minutes, I invite you to look beyond the diagnosis. Let's focus instead on the possibilities, the practical strategies, and the small but meaningful steps that can help you or your loved ones maintain independence, dignity, and a better quality of life. Let me begin by giving a brief understanding of Parkinson's disease. Dr. Needu and Dr. Vijit already told about it, but still, a Parkinson's disease is a chronic progressive condition that affects the nervous system. Most people recognize it through its key movement related features like stiffness or rigidity, slowness of movement known as bradykinesia, tremor, and problems with balance and posture. However, Parkinson's goes far beyond movement alone. It can influence the way a person walks, speaks, swallows, thinks, and even feels. Many individuals also experience sensory changes, behavior and cognitive challenges, disturbances in digestion, and changes in heart and lung function too. Parkinson's disease is a neurodegenerative disorder affecting both men and women and is most often seen in people above the age of 60. But Parkinson's doesn't always wait for old age. In some individuals, symptoms begin much earlier, before the age of 40, a condition known as young onset Parkinson's disease. For many of these individuals, the diagnosis can be unexpected and life changing as it arrives during a phase of life filled with responsibilities, ambitions, and family commitments. The term Parkinson's refers to a group of disorders characterized by basal ganglia dysfunction, producing the cardinal features like bradykinesia, rigidity, resting tremor, postural instability, and all. Parkinsonism is broadly classified into idiopathic Parkinson's disease, secondary Parkinsonism, and Parkinson's plus disease. As Dr. Vijit and Dr. Needu already explained well about the cardinal features and classification of Parkinson's disease. Let me talk about the rehabilitation, that is the physiotherapy, role of physiotherapy in the management of Parkinson's disease. So rehabilitation focuses on reducing functional limitations, promoting independence, and improving quality of life. Goals of rehabilitation is to improve mobility and gait, enhances balance and reduce falls, maintain strength and flexibility, improve posture and functional skills, support communication and swallowing, promote participation in daily activities. Rehabilitation also helps prevent complications such as deconditioning, contractures, respiratory issues, and depression. So effective management requires a team approach. Physicians for medical management, physiotherapists for mobility, balance, strength, and weight training, occupational therapists for correcting their ADLs, that is activities of daily life, speech language pathologist for speech and swallowing management, psychologists for cognitive and emotional support. So after detailed assessment, a patient-centered rehabilitation plan is developed based on the disease stage, functional limitation, patient goals, environmental and family factors too. So rehabilitation should be continuous, goal-directed, and regularly reassessed. In patients with Parkinson's disease, physiotherapy assessment, that is very important, assessment includes, we assess the musculoskeletal functions, motor functions, autonomic functions, and cardiorespiratory functions too. So in musculoskeletal assessment, flexibility, we check joint range of motion, especially the spinal mobility. Then comes the posture, whether the patient has stoop posture or forward head posture, or they have increased thoracic kyphosis and all. Then comes muscle performance. We check the strength and endurance of the affected muscles. Then comes the motor function assessment. We check the rigidity, whether it's lead pipe rigidity or cogwheel rigidity. Then comes bradykinesia, that is slowness of the movement. We check for the reduced amplitude, which may progress later to akinesia in later stages. That is, akinesia is no movement at all. Then comes tremor. We check for the location and severity of the tremor, whether it is resting tremor or action-initiated tremor. Then come postural instability. We check both static balance and dynamic balance. Then comes the important analysis in Parkinson's disease, that is the gait analysis, the way the patient walk. We look for the short shuffling steps, reduced arm swing, reduced trunk rotation, difficulty initiating gait, whether the patient is having fascinating gait, and the reduced foot clearance. Then comes autonomic assessment, which includes the drooling. Drooling is the drooling of saliva through their mouth. Then comes excessive sweating. Then comes orthostatic hypotension. And in cardiorespiratory assessment, we assess for the heart rate, blood pressure, respiratory rate, chest wall mobility, thoracic expansion, and all. This comprehensive assessment helps in planning an individualized rehabilitation program based on the patient's deficits and functional limitations. A combined approach of pharmacological management and physical therapy is essential for optimal outcomes. Physiotherapy enhances function, mobility, and participation. Physiotherapy interventions can be categorized into motor learning strategies, exercise training, balance training, locomotor training, that is gait training, and cardiopulmonary training. So let's briefly explain about the motor learning strategies. Motor learning focuses on improving movement initiation and execution by breaking long and complex movements into smaller components. Avoid dwell tasking to improve movement quality, and use repetition and task-specific practice. For example, visual cueing, like using floor markings placed perpendicular to their walking pathways, walking over colored lines to improve their step length, then stepping over hurdles to improve their dynamic weight transfer. These all will improve their bradykinesia, reduce freezing, and enhances motor control too. Then comes exercise training. Exercise training includes relaxation, flexibility, strengthening, and functional training. So what in relaxation exercises includes gentle rocking on vestibular board or therapy balls, slow rhythmic rotational trunk and limb movements, breathing exercises, gentle yoga exercises, which will reduce the rigidity and improve functional movement fluidity. Then comes flexibility exercises like active and passive range of motion exercises, which stretches the shortened flexor muscles and strengthen the elongated extensor muscles. Then passive positioning techniques like prone lying to reduce flexion contracture, which improve posture and prevent contractures of the muscle and joints. Then comes strength training. It is indicated especially in the mild to moderate stages of Parkinson's disease, which focus on extensor muscles especially, and can be done with dumbbells, resistance bands, loops, etc., which improves gait, balance, mobility, and reduce fall risk and enhances the quality of life. Then comes functional training. It focuses on improving daily mobility tasks, that is bed mobility, rolling, supine to sit to standing, sitting balance on therapy board, standing weight shift, trunk rotation and reciprocal arm swinging, step-ups on low platforms, wall or corner push-ups, which improve independence in their mobility and ADL, that is activities of daily life. Then comes balance training. Postural instability is common in later stages of Parkinson's disease. So we start static and dynamic balance exercises, weight shifting activities, reaching tasks, axial trunk and head rotation, therapy ball sitting exercises, single leg standing if safe. These improve postural control and reduce fall risk. Then comes locomotor training, that is gait training. So gait impairments includes slow speed, shuffling, reduced arm swing, and stooped posture, which can be corrected by treadmill training with overhead hardness, brisk marching practice, walking on floor footprints, arm swing training, postural correction during walking, and our goal is to improve step length, walking speed, and gait symmetry. Then comes the cardiopulmonary training. In cardiopulmonary training, we introduce diaphragmatic breathing, deep breathing exercises, chest expansion exercises, strengthening of neck, shoulder, and trunk muscles, which improve respiratory efficiency and endurance. In Parkinson's disease and in other degenerative brain disorders, management requires both pharmacological and rehabilitative approaches. So, pharmacological interventions mainly provide neuroprotective support and symptomatic relief. However, rehabilitation focuses on stage of disease, presenting symptoms, functional limitations, residual abilities, and the strength of the patient. Physiotherapy plays a crucial role in improving muscle strength, range of motion, functional mobility, endurance, and overall quality of life. At Vijayan Institute of Ayurvedic Medical Science, VIAMS, we focus on enhancing functional independence through a structured rehabilitation approach tailored to individual needs. Optimal patient outcomes are achieved through a comprehensive team approach involving physician, physiotherapist, speech therapist, naturopathist, psychologist, patient, and family members. This collaborative model ensures holistic care and maximizes patient benefit. Dr. Vijit, hello, Dr. Vijit,
Yes, yes, yes.
can you play that video now?
Yeah, sure, please. The video is playing, right?
I can see that. Hope every others can see that video too.
Yes, sir.
So these are the exercises what we do in patients with Parkinson's disease. These are the sample videos. Like it depends upon the patient condition. All these exercises cannot be performed in all patients. It depends upon their condition. As we said, we go through a detailed assessment plan. Then we classify the patient. Then we do these exercises. Patients are advised to do the exercises under the supervision of a medical practitioner only. These are the strength training exercises with weight cuffs on his leg, which increases the strength of his thigh muscles. And this is a postural correction exercises to reduce the forward stoop posture in patients with Parkinson's disease. This will improve the thoracic expansion as well. And this is marching practice in order to give a proper gait training, which will improve their arm swinging in walking as well as stepping in walking. So initially, the patient can do this exercise in sitting in a chair, and later they can progress in standing also. This is also a resistance training, which improves the posture. And this is locomotor training. The patient is supposed to walk in straight line. And these are small height hurdles, which is placed in between the patient's walking pathway, which will improve their step length. So this way of walking improves their fascinating gait, that is the freezing period. I think the video has stopped. Dr. Vijit? Okay, so
Yeah, that's the video.
hope you see all those videos. So please don't do these exercises unless you consult a doctor. Okay. So as we conclude today's session, I would like to leave you with one important message. Parkinson's disease may be progressive, but disability does not have to progress at the same pace. While pharmacological management plays a crucial role in controlling symptoms, physiotherapy plays an equally powerful role in preserving independence, mobility, confidence, and quality of life. Our focus as physiotherapists is not merely on treating rigidity, bradykinesia, or postural instability, but on restoring function, preventing complications, and empowering patients to move better and live better. Exercise is not just an adjunct therapy in Parkinson's disease, it is also a medicine. Early intervention, task specific training, balance rehabilitation, gait re education, strength training, cueing strategies, and patient education can significantly delay functional decline. Most importantly, Parkinson's management requires a multidisciplinary approach, that is, physicians, physiotherapists, speech therapists, caregivers, and most importantly, the patient, all working together as one team. To every clinician attending today, I encourage you to intervene early, assess function regularly, individualize rehabilitation programs, and motivate your patients consistently. And to the patients and caregivers who may be listening, movement is hope. Stay active, stay consistent, and never underestimate the power of guided rehabilitation. Let us move from symptom control to functional optimization. Let us move from limitation to participation. Let us move from fear of progression to confidence in management. Thank you all for your valuable time and attention. Let us continue to work together to improve the lives of people live with Parkinson's disease. Thank you.
Thank you.
Thank you, sir. It was indeed a very engaging session. Now, let me welcome Dr. Anup Siri, clinical psychologist. Dr. Anup addresses the emotional and psychological dimensions of Parkinson's disease. His work supports both patients and caregivers in coping with stress, anxiety, and behavioral changes associated with the condition. Over to you, sir.
Thank you. Am I audible?
Yes, sir, you are.
Yeah, thank you. Happy evening, everyone. Today on World Parkinson's Day, we are not only talking about movement symptoms, but also something often missed, the hidden sides of. You can change the slide. Okay, I'm sorry. Yeah, we can discuss about the hidden sides of Parkinson's disease. Most people know Parkinson's for tremors or slow movement, but scientifically, the Parkinson's is a neurodegenerative condition that affects multiple brain systems, including those responsible for emotions, thinking, and motivation. Let us look at the hidden aspects. First, anxiety and depression. Research shows that 40 to 50% of people with Parkinson's experience significant anxiety or depression. These are just not emotional reactions. They are also linked changes in the brain chemicals like dopamine and serotonin. Second one, cognitive changes. People may notice subtle difficulties in memory, attention, and processing speed. This is not a sign of weakness. It reflects the changes in the brain circuits involved in thinking. Third one, the motivation. Some individuals experience what we call apathy, that means reduced drive to initiative activities. This is often misunderstood as laziness, but it is actually a neurological symptom. Next thing, emotional impact on identity. A diagnosis can deeply affect how a person sees themselves, their roles, independence, and future. This can lead to grief, fear, and uncertainty. Finally, the awareness. These symptoms are often hidden even from family members and also healthcare providers. Recognizing them the first steps towards proper care. So Parkinson's disorder is not just about movement, it's about the whole person. Next slide, please. Yeah, when we are discussing about the care gap, traditionally Parkinson's care has found mainly on medication. Medicines are very essential and also help manage motor symptoms effectively. However, mental health is often overlooked. Many patients do not receive routine screening of depression, anxiety, and cognitive changes. This leads to underdiagnosis and undertreatment. Next, neuro rehabilitation services. Evidence strongly supports physiotherapy, occupation therapy, speech therapy, and psychological support. Yet these services are often not available in every centers. But our VIAMS is always providing everything. There is a multidisciplinary team for this. Because if many people experience what we call an incomplete recovery journey. Their physical symptoms may be treated, but their emotional and functional needs remain unmet. This highlights the need for holistic care that integrates medical, psychological, and rehabilitation and social support. In modern healthcare, we understand that treating only the disease is not enough. We must support the person living with the disease. Next slide, please. Yeah, when we move to the role of psychology, now where does psychology fit in? Psychology plays a crucial role in strengthening mind and improving overall outcomes. First one, cognitive training. Structured exercise help maintain attention, memory, problem-solving skills. Research shows that regular mental stimulation and that supports brain function. Emotional support. Counseling helps individuals process their diagnosis, managing stress, and reduce symptoms of anxiety and depression. Coping strategies. Patients learn practical skills such as pacing activities, relaxation techniques, and problem solving to manage their daily challenges. Family guidance. Families are an essential part of care. Educating them reduces misunderstanding and improves support at home. Finally, overall outcome. Studies consistently show that when psychological care is integrated with other treatments, quality of life improves significantly. So psychology is not an optional add-on. It is core component of comprehensive Parkinson's care. Next slide, please. When we are discussing about neuroplasticity, it's an important scientific concept. Neuroplasticity means the brain has the ability to adapt and form new connections. Even Parkinson's disease, the brain retains this ability. New pathways. When some neural circuits are affected, the brain can reorganize and create alternative pathways. Consistent practice, whether physical exercises, speech therapy, cognitive tasks, strengthens these connections, these new connections. Practice improve function. With regular training, patient can regain and maintain abilities such as movement, speech, and daily activities. Foundation of rehabilitation. All rehabilitation approaches are based on neuroplasticity. Improvement is possible because the brain can adapt. Finally, functional gains. These changes lead to real-life improvements, better mobility, communication, and independence. This is very hopeful message. There is a very hopeful message. Even though Parkinson's is a progressive condition, the brain still has the capacity to learn and adapt. Last slide, please. I would like to end with one key message: focus on the whole person. Parkinson's disease affect movement, yes, but also emotions, thinking, relationships, and identity. So care should include medical treatment, psychological support, rehabilitation, family involvement. When we look at the whole person, not just the symptoms, we promote dignity, quality of life, and meaningful living. Let's move to the disease-centered approach to a person-centered approach. Thank you.
Thank you, sir. Now I welcome Ms. Dilna Sultana, audiologist and speech language pathologist. Ms. Dilna focuses on communication and swallowing disorders in Parkinson patients. Her intervention play a crucial role in improving speech clarity, safety in swallowing, and overall quality of life. Over to you, ma'am.
Good evening, all. Hello.
Audible. You're audible, loud and clear.
Okay. So, good evening, all. So, on Parkinson's disease day, I would like to talk about what is Parkinson's disease in speech therapy. So, in speech therapy, Parkinson's disease is defined as a progressive neurodegenerative movement disorder causing hypokinetic dysarthria. It results from dopamine loss, forcing therapy to focus on increasing vocal intensity, improving breath support, and slowing speech rate. Parkinson's disease commonly causes speech and swallowing issues due to rigid muscles and reduced motor control. The problems include soft or monotone voice, slurred speech, choking, drooling, and weight loss, which often progress over time. Next slide, please, sir. So, now we'll discuss about the speech difficulties that are seen in Parkinson's disease patients. The one is hypokinetic dysarthria, then the next one is hypophonia, then the next one is monopitch or monotone, then the next one is rapid speech, then imprecise articulation, and delayed initiation. So, now we'll discuss about hypokinetic dysarthria. So, what is hypokinetic dysarthria? It is a common, often early speech disorder in Parkinson's disease, characterized by hypophonia, monotone pitch, breathy voice, imprecise articulation, and it arises from basal ganglia damage, leading to rigid, slow, or low volume speech. Then the next one is hypophonia or reduced volume, which is the voice becomes very soft or breathy. Then the next one is monopitch or monotone, which means lack of voice inflection. Then the next one is rapid speech, also called fascinating speech. In this, the words may rush together. Then the next one is imprecise articulation. Here, the speech will be mumbled or the words will be very slurred. Then the very last one is delayed initiation. There will be difficulty to initiate speaking. Now, we'll discuss about the reasons for speech difficulties. The reasons are under motor impairment, reduced motor amplitude, loss of sensory perception, and non-motor symptoms. So the motor impairment or dysarthria in Parkinson's disease patients impairs muscle coordination, which leads to weak voice, breathiness, hoarseness, and imprecise articulation. Then the next one is reduced motor amplitude. Just as Parkinson's makes movements smaller or slower, which has been told by Dr. Prasad sir, and also it makes speech movements smaller, which results in reduced vocal volume. Then the next one is loss of sensory perception. The people with Parkinson's disease often lose the ability to gauge their own voice volume, often thinking they are talking very normally when they are actually whispering, often referred as a recalibration issues. Then the next one is the last slide itself. So the next one is non-motor symptoms. In this, cognitive changes such as difficulty finding words or slowing thoughts can also lead to speech pauses and reduced verbal output. Next slide. Okay, now we'll discuss about the difficulties that is seen in swallowing, or the swallowing problems that are seen in Parkinson's disease. So difficulty in swallowing, also called as dysphagia, is defined as a disorder that is characterized by difficulty or discomfort or inefficiency in swallowing involving the mouth, throat, pharynx, or esophagus. It is a functional impairment in moving food or liquid from mouth to the stomach. The swallowing problems are oral stage issues, pharyngeal stage issues, aspiration, silent aspiration, and weight loss or malnutrition. So oral stage issues means difficulty chewing, maneuvering food, or controlling the saliva, which will lead to drooling. Drooling means the saliva will be coming out of the mouth. Then the next one is pharyngeal stage issues. In this, food or liquid sticking in the throat, needing to swallow multiple times. Then the next one is aspiration, which is common. Food or liquid enters the airway, causing choking or coughing. Then the next one is silent aspiration. In this, food or liquid enters the lungs without causing a cough. Then the very last one is weight loss or malnutrition, which is due to eating difficulties and prolonged meal times. Then the reasons for swallowing problems include swallowing difficulties in Parkinson's disease occurs because of the weakness or in uncoordination of the muscles in the mouth, throat, and tongue movements. This leads to delayed swallowing, slow tongue movements, and reduced throat muscles, increasing risk of choking, aspiration, pneumonia, and poor nutrition. The reasons for swallowing difficulties include muscular weakness and rigidity, delayed swallowing reflex, reduced muscle coordination, reduced frequency of swallowing, and weakened cough. So in muscular weakness and rigidity, the involuntary movements and muscle rigidity associated with Parkinson's disease extend to the muscles used for chewing and swallowing. Then the next one is delayed swallowing reflex, a disruption in brain signals which causes a delay in triggering the swallow mechanisms, which causes food or liquid to sit in the throat and potentially fall into the airway. Then the next one is reduced muscle coordination. Poor control of tongue, cheek, throat muscles make difficult to move food from the mouth to the stomach. Then the next one is reduced frequency of swallowing. Because of the slowness of movement, people with Parkinson's disease swallow less often, leading to an accumulation of saliva. Then the next one is weakened cough. A weakened cough reflex makes it difficult to clear the airway if food or liquid accidentally enters it. That next slide. Okay. Now we will discuss about the importance of early speech therapy for Parkinson's disease. Okay, early speech therapy for Parkinson's disease is critical to preserving voice loudness, speech clarity, and safe swallowing, often slowing the progression of communication challenges. Starting therapy early, such as with LSVT, which means Lee Silverman voice therapy, which strengthens the vocal muscles, boosts confidence, maintains social connection, and prevents swallowing safety risks. The key benefits of early speech therapy is vocal preservation, swallowing safety, preventing social isolation, improved cognitive function, and muscle maintenance. So what is vocal preservation? In this, the exercises is given to increase the volume and clarity, countering the soft voice, which is common in Parkinson's disease. Then the next one is swallowing safety. Early assessment identifies swallowing difficulties, decreasing choking risks, and improving nutritional health. Then the next one is preventing social isolation. Early interventions build confidence in communication, prevents with withdrawal often caused by slurred or slow and low voice. Then the next one is improved cognitive function. Therapy can help manage cognitive changes, memory, and word finding difficulties associated with the disease. Then the very last one is muscle maintenance. Just as physical therapy supports mobility, early speech exercises strengthen vocal muscles to slow symptom progression. Sir, next slide. So now we'll talk about when to consult a speech language pathologist. To consult a speech language pathologist as soon as any changes in voice, speech, or swallowing is noticed, or upon the diagnosis, or to establish with a baseline. Now we'll discuss about the common therapeutic techniques that is included in speech therapy. LSVT, as I have told you before, Lee Silverman voice therapy, which focuses on increasing vocal intensity. Then the next one is speak out, focuses on speaking with intent. Then the next one is breathing technique. Exercises are provided to improve respiratory support for speech. Then the next one is pacing technique. Pacing techniques in speech therapy is to slow down speech rate and improve clarity for individuals with dysarthria, apraxia, or fast talking, or a person with fast rate of speech. This technique will be done by tapping for each words, or each tapping will be done for each word or syllable, and the patients improve intelligibility and articulation by this technique. Then the next one is called oral motor massage, which involves gentle, firm stimulation of the facial muscle, which is cheeks, lips, jaw, and to improve muscle tone, coordination, and sensory awareness for better speech clarity, swallowing, and feeding. Often used in speech therapy for children and adults, these techniques can reduce drooling and oral sensitivity. Then the next one is contrastive stress drills. Here, by this technique, we can improve the speech prosody, intelligibility, and motor speech control by training speakers to emphasize specific words to alter meaning. This technique includes highlighting target words, using voice modulation, and responding to targeted patient to change the stress placement within the sentences. Then the next one is vegetative skills. Vegetative skills are fundamental non-speech oral motor functions. So, such as sucking, swallowing, chewing, and blowing are coming under this. So, that build the necessary muscle strength, coordination, and stamina for speech development. So, these reflexive or routine actions, including coughing and yawning, train the tongue, lip, and jaw for later articulation. So in therapy, we'll provide with candles and with paper balls for blowing technique. And for swallowing technique, we'll be providing with honeys. And for sucking, we'll be giving with the straws, which will be placed in the glass, and we'll ask the patient to be drank from the glasses. So now we'll discuss about the recommendations. There are three recommendations, mainly three recommendations are there. The first one is don't wait. Immediate intervention is more efficient than waiting for severe impairment. Then the next one is involve caregivers. Therapy provides strategies for families to improve daily communication. And the next one is combined therapies. Group therapy or singing, such as in Parkinson's disease choirs, can be effective and can be an engaging tool. So now we have discussed about the Parkinson's disease and what are the speech and swallowing difficulties that are seen in Parkinson's disease, why those problems occur, and what are the importance of early speech, language, and swallowing therapy in Parkinson's disease. So here I conclude by telling a message for Parkinson's disease in a speech therapy, which is to speak with intent to counteract the tendency of the disease to make speech softer, faster, and less articulate. Hope you all understood. Thank you.
Thank you, ma'am. Now, I would like to invite Dr. Vijit once again to conduct an elaborative session on the integrative treatment for Parkinson's disease. Over to you, sir.
Thank you. I hope I'm audible, correct? Yeah. So thank you to each and everyone of our panelists for those insightful and meaningful sessions. So if you, we will, as the time is pressing, I will conclude in 5 minutes and we will go to the Q&A sections. So if you observe closely, what we have here today is not just different opinions. It is actually different pieces of the same puzzle coming together. Dr. Needu helped us understand how Parkinson's in women, maybe this is new for you, often goes unrecognized, and how caregivers silently carry an emotional burden. Dr. Aditya walked us through the structured Ayurvedic management, focusing not on symptoms, but a long-term balance. And Dr. Aruna reminded us of the body's natural ability to heal when supported in the right way. Dr. Prasad showed us the movement can be retained and the recovery is possible through consistency. Dr. Anu brought us forward the hidden emotional challenges which are often overlooked. And in the end, Dr. Dilna highlighted how even communication and swallowing need early attention and care. Now, when we bring all this together, one thing becomes very clear. Parkinson's is not just a neurological condition. It is a condition that affects the entire life of a person. And that is exactly why a single approach is never enough. So when we truly need is an integrative approach, an approach that does not look at Parkinson's in isolation, but understand the patient as a whole person. Because Parkinson's affects the movement, it affects emotions, it affects communication, it affects independence, and it affects the family as a whole. So that is where real transformation begins. Because when care is integrated, outcomes are better, and more importantly, the quality of life improves. As a part of this integrative approach, we also focused on developing solutions that can support patients consistently in their day-to-day life. And that is where MyDopa plays an important role. MyDopa is designed based on Ayurvedic principles to support neurological balance in a natural and sustainable way. It is not just aimed at managing symptoms, but also at supporting both motor and non-motor aspects of Parkinson's. And importantly, it is meant to work along with other therapies, not as a standalone solution, because again, integration is the key. When we follow the right approach, what we start seeing are real, meaningful changes in patient lives. Patients begins to walk better, their balance improves, stiffness reduces, speech becomes clear, swallowing becomes safer, sleep improves, confidence improves, and gradually independence starts returning. These are not just clinical outcomes. These are life-challenging improvements. So, and at this point, I want to tell every patient and every caregiver who is listening today, Parkinson's is not the end of the journey. It is a condition that can be managed. It is a journey where improvement is possible. With the right approach, with the right support, and with consistency, quality of life can truly improve. You are not alone in this journey, and every small step toward is a meaningful victory. So, if there is one thing I would like all of you to take back from today, understand the condition early. Do not ignore early signs. Choose an approach that looks at the whole person, not just the disease. Start early, because early intervention makes a significant difference. And most importantly, stay consistent and stay hopeful, because progress is always possible. Thank you once again for being part of this session. We would now be happy to take your questions and interact with you. Over to you. Please unmute your mic and ask your questions, please. And if somebody's want to ask in Malayalam language, local language, you can ask as well. Thank you. Over to you. You can unmute yourself and ask your question, sir. There are some questions in the chat box which I had answered already. Priyanka Kekwad also tell us about PSP, please. Having PSP. Definitely, progressive supranuclear palsy is also a neurodegenerative condition, but the supranuclear area gets affected, and tremor will not be predominant in PSP, but the imbalance, especially to backside, the eye movements will be restricted, the facial movements will be restricted, depression will be there. So these are the cardinal symptoms of PSP, and walking also get disaffected, and speech and swallowing will be definitely affected in PSP. I'll share more the details, Priyanka. Thank you. If you have any questions now, please ask.
Yeah, yes, sir. I am having the question.
Please.
So, can PSP also recovered?
Yes, if it is in the early stage, definitely we can manage it. See, recovery in the sense, see, the cure, the complete cure or the reversal will not be possible in or in any neurodegenerative condition, whether it is Parkinson's or PSP or whatever it may be. It is, but if it is in the initial stage, see, the PSP, the patient will be suffering with the speech and swallowing, severe choking, dysphagia will be there, choking will be there. So there are high chances of getting food leaked into the lungs, and the aspirational pneumonia will be the a risky thing in the people with PSP. And the imbalance problem will be, falls will be to backside, and double vision will be there because of that restricted eye movement. So suppose they believe that they had reached somewhere, but actually they missed the catch and fall will happen. So complete reversal is really difficult, Priyanka. But if it is in the early stage, if you can share all the details of your mother, we will take a online consultation and we will go forward. I will advise you exactly during that consultation.
Sure, sure. And one more question, sir. That Parkinson PSP is same or different? How it is like?
It's exactly, it's entirely different. See, both comes under neurodegenerative disease. Typical Parkinson disease is because of the degeneration of substantia nigra cells, which is a part of the midbrain, and because of that degeneration, a dopamine, that is a neurotransmitter, that production will be very low, and the Parkinson symptoms will be seen. But in PSP, progressive supranuclear palsy, the supranuclear area, there is a part in the brain which is known as supranuclear area. That part will be degenerated along with the bulbar area, because the supranuclear area is controlling the eye movements and eye muscles and eye nerves, and the bulbar area is controlling the speech and swallowing, because it is most of the symptoms will be mixed in this PSP. So, and in PSP, tremors will not be there.
Okay. And Ayurvedic, with the Ayurvedic treatment, if you give Ayurvedic medicine, okay, will it be solve all this problem, or we can slow down this disease?
Nothing, see, not only Ayurvedic medicine. See, what we have talked is an integrative approach, because people with Parkinson's is definitely they need physiotherapy and speech therapy for sure to overcome situations. So with the Ayurvedic internal medicines, definitely we can slow down the progression.
Yes.
And we can, with medicine we can slow down the progression, and with the Shodhana, that is the Panchakarma therapy, definitely we can improve the stiffness, rigidity, walking and everything that we can improve. Along with the physiotherapy and the speech therapy, definitely the patient will get a new life, no doubt about that.
Okay, so you also provide the Ayurvedic medicines?
Yes, we have. Initially, see, Dr. Aditya mentioned the treatment is based on three stages: Shamana, Shodhana, and Rasana. So Shamana, like patient with long distances, will take an online consultation. We will send the medicines to courier for 1 or 2 months of time. After symptomatic improvisations, they are advised to take an in-house treatment at our hospital. During that in-house treatment, we will be integrating this physiotherapy, speech therapy, psychology counseling, naturopathy, and whatever needed.
Okay. Yeah. Thank you, sir. Thank you so much.
Thank you, Priyanka. Good day.
Thank you, sir.
So there is a message from Millie. Thanks very much to all your team, doc. Okay, so Millie is from Lithuania, all the way from Lithuania. Thank you, Millie, for joining. Any more questions?
Sir, this online consultation, to whom we have to contact?
Please drop your contact. I will make a call back from the hospital.
Okay.
Okay. I'll share the booking number in the chat box. Please note that as well. It is 7034992442. I repeat, 7034992442.
Okay.
WhatsApp is also available in that number.
Also, we have to continue this English medicine also along with this.
Yeah, initially you have to continue the allopathic medications, and slowly we can taper the dosage of the allopathic medications. When the patient feels stable, we can gradually taper the dosage. It is not advisable to stop the allopathic medicines in a fine day morning. That will get great side effects. It is not advisable.
Okay. Where is your clinic located?
We are located in Palakkad district, Kerala.
Address.
Hello, doctor.
Yeah.
Am I audible?
Yes, you are.
Yeah,
Yes.
the Mydopa medicine you have recommended. How long this should be taken, and can all Parkinson patients should take this Mydopa medicine?
Yes, sir. Any Parkinson patient can take that Mydopa, because Mydopa contain 5 ingredients. One major ingredient is Kapikachu. It gives natural levodopa. That means this is because of the loss of dopamine. So because of the by the result of this natural dopamine, natural levodopa, the dopamine will be produced. And the ashwagandha is the next ingredient. So ashwagandha is known as the neuroprotector, antioxidant. That means this is a progressive disorder. So the degeneration of the nerve cells can be controlled with the effect of the ashwagandha. And third is triphala. It's a combination of 3 drugs. So it will regulate the gut health, because gut health is very important in the treatment of Parkinson's disease, because Parkinson's disease really starts from the gut, not from the brain. So the gut health is very important. So this Mydopa will be effective in any neurodegenerative, especially Parkinson's or typical Parkinson's or Parkinsonism.
Yeah, also taking magnesium supplement would be helpful.
You can, yes, definitely. You can take that.
Okay, thank you.
Thank you.
This Mydopa is Ayurvedic or what, sir?
Yes, it's completely Ayurvedic ingredients. It's placed as
And our allopathic doctor has given Syndopa.
Yeah, Syndopa means it's a combination of levodopa and carbidopa. So levodopa it's a lab based, and the levodopa what we are providing from Mydopa is purely plant based. It is entirely different. The Syndopa needs carbidopa to enter the blood-brain barrier, but this Mydopa does not need a carbidopa, because the levodopa is plant-based, and the levodopa itself, the plant-based levodopa will break the blood-brain barrier because it contains fat molecules. It is processed in milk.
Okay, so if we are taking Mydopa, then Syndopa is not necessary to take.
Yes. And in PSP, the Syndopa will not be effective, because like the impact of the Syndopa in Parkinson's and PSP is entirely different. But definitely in people with Parkinson's disease or people with less dopamine, this Syndopa or levodopa carbidopa will be affected.
I will share you our medications which we are already taking, right? I will share you.
Conventional medicine have some limitations in the treatment of these type of neurodegenerative diseases. They don't have any other choice. That's why. But we do have.
Taking Mydopa will reduce the effect of Syndopa tablets?
Nothing like that. See, after taking this Mydopa, you will be able to reduce the dosage of the Syndopa, because Syndopa is having a long-term side effects like dyskinesia. Mydopa doesn't have any side effects like that.
Okay.
You can stop Mydopa any day, but you can't stop that carbidopa, levodopa, that is Syndopa in a day, because you will be completely frozen.
So after taking Mydopa, can one gradually reduce taking Syndopa tablet?
100%, sir, you can. That we will, my doctor team will advise you how to reduce.
Okay, thank you.
Okay, now my mother is already taking 20 days. She's completed, and now she is in 1 month again. Doctor given the medicines. So is it any problem if we stop after 1 month or in between months?
See, gradually you have to taper if the patient is taking one tablet 3 times a day, initially they have to reduce one half, then one half, then half, like that. Gradually taper the dosage and then stop it.
Then we can go to MyDopa.
Yeah, definitely.
Okay, so there will be no like side effect, anything.
Nothing like that. I can share you all lab report as well, the complete lab report also.
Yeah, and how we can come to know that she is recovering or not? How much percentage?
Symptomatic improvisation will be there.
Sorry.
Symptomatic improvisation will be there, because if the person, people with PSP, they have eye movement restriction will be there. After our treatment, eye movements will be moving. Staring will be there. That staring will be normal, and sleep disturbances will be there. She can sleep normally.
And then blinking will start.
Yes.
Okay, so there is this like feedback result is there with you, like you can show us.
Lot of cases. Even I can share you some testimonials as well if you drop your contact.
Yeah, already I am in touch with you.
Yeah.
Somebody
in my team will send you the testimonials as well.
Yes. So we'll come to know that yes, we can if go with that, because allopathic is saying no, Ayurvedic will not help you. It will goes on worsen. They are not giving proper guidance.
Because they don't know anything about Ayurveda. I have a lot of allopathic doctors, even retired medical college principals are in my patient list. Allopathic medical college principals are in my list. Okay, and even from abroad as well.
Okay, correct. So they are saying like that. So we have so because of that reason we have to think, because this is something major.
No, it's your turn to think twice whether you have to just simply blindly follow that advice of an allopathic doctor. You just ask whether you just say that I don't take Ayurveda. Is it completely curable, or can I manage, or at least can we slow down the progression with allopathic medicine? Just ask a simple question to your neurologist.
No, they're not said like that. They said it will be day by day version only. So before
then why don't
after hearing that, I was very broke down. Really, like why he's
nothing like that.
Yeah, we need a proper guidance actually.
This is where I apply psychology. My psychologist will talk to the patient. My psychologist will talk to the caregiver. My psychologist will talk to the family members. It's a 3-tier setup. Definitely, the family will grow up. That's it.
Okay, so yeah, definitely. So it will be and we need to bring the patient over there.
Yeah, initially you take an online consultation. The patient should be along with you. I just want to see the patient at least through the camera.
Yeah,
and I have to go through all the available reports, whether any MRI or anything like whatever reports you have, and your medicine list as well. According to that, I will advise you what to do. If you want an immediate hospitalization, I will advise you that. Or if you can able to take the medicines for 1 or 2 months, symptomatically improvise, then you travel to Kerala.
Okay, fine. We will try definitely.
Yeah. Okay. Thank you.
Yeah.
ഹലോ
Yes.
സാർ, ഞാൻ ബാംഗ്ലൂരിൽ നിന്നാണ് വിളിക്കുന്നത്.
പറയൂ.
ഞാൻ ഇപ്പോ LCD ടാബ്ലറ്റ് ആണ് കഴിക്കുന്നത്, 4 എണ്ണം.
കാർബിഡോപ്പ കോമ്പിനേഷൻ തന്നെയാണ് സാർ.
ഓക്കെ, അതിപ്പോ എഫക്ട് കുറവാണ്. മുമ്പ് എഫക്ട് കുറച്ച് ടൈം എടുക്കുമായിരുന്നു. ഇപ്പൊ ഒരു 1 hourലൊക്കെ പിന്നെ എഫക്ട് കുറഞ്ഞിട്ട്.
Yeah, this is another drawback of this LCD or Syndopa, because if you initially you will get either 3 hours or 4 hours, then it will reduce. Then you have to increase the dosage. That is the main drawback of this conventional allopathic medicines.
Okay, ഈ MyDopa എത്ര കഴിക്കണം ഒരു ദിവസം?
അത് 1.5 gram sachets ആണ്. Generally 2 to 3 sachets.
ഇതിപ്പോ ആദ്യം നമ്മൾ അവിടെ വരണോ കൺസൾട്ടേഷന്?
ഒരു ഓൺലൈൻ കൺസൾട്ടേഷൻ ബുക്ക് ചെയ്യൂ. നമുക്കൊരു we will take an online consultation and I will advise you and I will send you the medicines if needed.
Okay, ഇത് പാലക്കാട് എവിടെയാണ് നിങ്ങളുടെ സ്ഥലം?
എക്സാക്ട്ലി തൃത്താല, മേഴത്തൂർ എന്ന് പറയും, പട്ടാമ്പി അടുത്ത്.
ഓക്കെ, ഞാൻ ആക്ച്വലി പാലക്കാടുകാരനാണ്, പക്ഷെ ബാംഗ്ലൂർ സെറ്റിൽ ഇല്ലെന്നേ ഉള്ളൂ. അപ്പൊ ഇടയ്ക്ക് പാലക്കാട് വരും. അപ്പൊ നേരിട്ട് വന്ന് കാണാൻ
വരുമ്പോ വന്നാൽ മതി.
അല്ല ആദ്യം ഇപ്പോ ഇത് ഓൺലൈനിൽ
ഒരു ഓൺലൈൻ കൺസൾട്ടേഷൻ എടുക്കാം സാർ. നാളെ ഇല്ല, മൺഡേക്ക് ഒരു ഓൺലൈൻ കൺസൾട്ടേഷൻ ബുക്ക് ചെയ്തോളൂ. സോ വിൽ ടേക്ക് എൻ ഓൺലൈൻ കൺസൾട്ടേഷൻ ആഫ്റ്റർനൂൺ.
ഓക്കെ. ഇപ്പൊ വാക്കിംഗ് കുറച്ച് ഡിഫിക്കൽട്ട് ആയിട്ട് പെട്ടെന്ന് ഫ്രീസ് ആവുക, സ്റ്റെപ്പ് വരുന്നില്ല.
We can go through it, no problem.
ഓക്കെ, എന്തായാലും ഞാൻ പാലക്കാട് പേരോട് വരുന്നുണ്ട്. അതിന് മുമ്പ് ഓൺലൈൻ കൺസൾട്ടേഷൻ ഇത് സ്റ്റാർട്ട് ചെയ്യാം.
Okay, sure.
ഓക്കെ, താങ്ക് യു ഡോക്ടർ.
Thank you. So I think there are no more questions. So before I conclude today's session, I would like to take a moment to express something truly important to every patient who joined us today. Thank you for your strength. Living with Parkinson's is not easy. And yet, every single day, you continue to move forward with courage that often goes unseen. To every caregiver, thank you for your patience, your compassion, and your silent sacrifices. And the care you give, the time you dedicate, and the emotional strength you carry make a difference far beyond words. And to all our participants, families, well-wishers, and healthcare professionals, thank you for taking time to learn, to understand, and to be part of this journey. Today was not just a webinar, it was a shared space of awareness, support, and hope. We deeply value your presence, and more importantly, we honor your journey. Please remember, you are not alone in this. We are with you every step of the way. Thank you and namaste. Good night.